Hi, I'm Dr. Jiang. Today we're going to discuss about COVID-19 lab testing. Right now, there are two kinds of testing going on. A, PCR testing. B, antibody testing. In the first one, where we check the genetic material of coronavirus, it can be done as early as 3 days after the exposure to the virus. How is it done? We take a swab similar to this one and pushed all the way back to the patient's nose and take the nasopharyngeal sample and send to the lab and check for the actual copies of viruses. If it's positive, that means the patient has been infected with the coronavirus. If it's negative, there could be two possibilities. A, patient had been infected, however, your test is not sensitive enough to pick up the signal. In this case, we can choose to repeat it. B, the patient truly have never been infected with coronavirus. Next way is the specific antibody testing. This one checks for the specific antibodies against the coronavirus. There are two different kinds of sampling, finger stick or venous sampling. Personally, I don't like finger stick blood samples. It's not accurate in detecting the virus antibodies. This test can be done as early as 7 to 14 days after exposure to the virus. If it's positive, or if it's negative, that means the patient has never been infected with coronavirus. However, when the antibody testing came back positive, there are few possibilities. A, patient might be infected with the coronavirus, and now the body has a lot of antibodies. However, we are not sure whether these antibodies are protective, are able to protect the patient from getting future coronavirus infection. Hopefully in a few months we can find you answer to this question. And another problem with this antibody testing is it's of lower specificity. So a lot of people might never have been infected with coronavirus. However, their test came back as false positives. So in my opinion, this antibody testing is not useful for individuals. It's only useful for scientists and doctors to roughly estimate how many people have been infected with coronavirus in a certain population. That's all we are discussing today. I hope you like my video.